More than 350 Oregonians are now in the hospital with COVID-19 complications. We're told most of them chose not to get vaccinated. As the hospital numbers continue to climb, it's causing more problems for people who need surgeries. Our Lisa Balick is tracking the surge. So Lisa, what are you learning?
Well, it's interesting, as you just mentioned, the hospitals are filling up, and that means hospitals have to find beds for the COVID patients who are at potential risk of dying, and that's affecting some of the surgeries that were planned. Hospitals in Oregon are busy right now. Dozens of COVID patients coming in daily and staying, most unvaccinated, dozens fighting for their lives on ventilators in the ICU.
With the increase in surge, as well as with the concern around the heat, there were urgent meetings called within all regions.
I found out some hospitals like OHSU are postponing some surgeries that are not urgent but would require an overnight stay. It's to try and keep beds available for emergency patients. It's a tough time of year.
In addition, this is the summer season, and so oftentimes there's an increase in people who need to be hospitalized due to traumas. And lastly, there are people who need hospital level care for other medical issues. We know that this has been an incredibly stressful year on people, and we know that some people have had to defer care.
And I want to share a closer look at the COVID numbers. Take a look. In November, at the peak, 662 Oregonians hospitalized with COVID. Today, it's 353, more than halfway to the peak again. One big difference, there was no vaccine in November. Now, most all the COVID patients filling up the ICUs chose not to be vaccinated. And a third of Oregon counties still don't have even half of their adults vaccinated. And the state officials tell me they are looking at perhaps 100 new cases a day, each day for the next several weeks, a situation that is getting extremely grim once again. Live in downtown Portland, Lisa Balick, KOIN 6 News.
And the numbers we're seeing now are much higher than they were a year ago. Lisa Balick, thank you. Kaiser Permanente announced it's requiring healthcare workers to get vaccinated. This does not apply to those working in Oregon. That's because of the 1989 law we've told you about in Oregon that makes it the only state in the country where it's against the law to require vaccinations. Other states with Kaiser Permanente healthcare workers, including Washington, can require workers to get vaccinated. Kaiser says it's working with the Oregon Health Authority and the governor to support vaccinations to the fullest extent permitted by law.
Oregon health officials reporting more than 2,000 new cases of COVID-19 over a 3-day period. That includes cases since Friday, but it is concerningly high. The counties with the most new cases: Multnomah, 320, Lane, 305, Clackamas with 183, and down south Jackson County with 132.